The Newsday continues here on One News Now. I'm Diego Castro. The nationwide COVID-19 positivity rate, or the percentage of people who were found positive among those tested, has declined over the past few days. That's according to OCTA research. Citing data from the Health Department, OCTA research fellow Guido says the country's positivity rate has dipped to 4.2% as of Monday, January 9. That's lower than the 5.5% reported the day before. On the same day, the DOH tallied 473 new cases, a little over OCTA's projection of 350 to 450 cases for the day. Nearly 150 of the new cases recorded yesterday were detected in the National Capital Region. OCTA says it is projecting 200 to 300 new cases for today. Let's discuss these figures further with OCTA Research Fellow Professor Guido. Prof, good morning. Thank you for joining us.
Hi, good morning and Happy New Year, Diego, and to our viewers and listeners.
Yes, Prof, what do these numbers tell us? Are you seeing a continuous downward trend in COVID-19 cases?
In most areas, yes, we're seeing a continuous decrease in positivity rate in Metro Manila. The positivity rate actually decreased now to about 5.8%. And in other provinces, we're already seeing low positivity rates. That means less than 5%. So in Batangas, in Bulacan, in Ilocos Norte, and Pangasinan, to name a few. But there are still some areas with very high or with high positivity rates, like Albay with 25.6 positivity rate and Isabela with 35.1% positivity rate. These are still high, and we're noticing that Isabela has been registering fairly high or relatively high numbers of cases. So while we are on possibly a downward trend, it's not well, we don't necessarily expect this to continue on till the rest of the year. There will probably be another uptick or an increase in cases because we're monitoring another active subvariant in the US right now. It's XBB 1.5 that may be causing a new wave in other parts of the world.
Speaking of the current downward trend, Prof, could it be simply because the current symptoms that people experience from COVID-19 are very mild, so nobody gets tested anymore. It's like it's not the norm anymore as compared to when the pandemic started. So therefore, we don't have an accurate count or number of really who are infected.
We don't really have an accurate count, Diego, and that's true. We have to be transparent. The level of testing that we're conducting now is only about 25% of what we were testing, let's say, in 2021. And it's even lower than what we were testing last year, in the first half of last year. So testing has really decreased. One of the reasons is that more people are using antigen tests, and that's why we exhort the institutions to, if they could report the antigen test results. A lot of people are using antigen tests because they're cheaper, they're faster, they don't use laboratories. But there are testing centers that administer these, so they could possibly report these test results at least, so we can get a better sense of the numbers. And as you said, more people are experiencing milder symptoms because of Omicron. So a lot of people are not even getting tested, or maybe they're just self-testing. And this is not adding to the numbers. So the lower numbers we're seeing is a reflection of these things that have happened more recently. But of course, we're still seeing the trend that it's decreasing. So I think the trend is realistic. But then again, of course, we may be having cases coming in from China. We know that in China, their official number is 0 cases per day. But they're registering somewhere between, around maybe 20 million cases per day, somewhere in that neighborhood. And so, that's definitely underreporting from that region.
Prof, you mentioned a while ago that we can expect an uptick of cases soon because of the new variant you mentioned a while ago. What kind of uptick can we expect? And will the low number of those who have taken their booster shots affect this uptick?
Definitely, Diego, because from what we know, if we get infected or if we get the booster shots, we usually have a strong protection against reinfection for about 3 months, maybe up until 6 months. But after that, we have waning immunity, and then people will become more susceptible again, and individually. There will be reinfections, and when can we expect the uptick? Well, it could happen around February. I mean, it's not yet very clear, but we get this, like we said, if we get this new subvariant XBB 1.5, or there may be a new subvariant that's lurking. We don't know what's happening in China, so there could be, it's possible that there will be a new variant coming out of China because of the sheer number of cases. They could be reaching 1 billion infections already by this month or February. So, but what kind of uptick will we expect? It will probably be a bit similar to what we experienced in the past few months because of the low testing. We won't really see the scale of the infection. And that's what we were even saying the past 6 months. We're not seeing the full scale of the waves that we saw. Yeah, they're not as bad as before, as with January last year, but the numbers are still underreported.